So what is botulinum toxin? Botulinum toxin is used as an injection to treat fine lines and wrinkles and other issues that can arise from muscle movements. What can it be used for? Well, it can be used for lots of different reasons. For instance, you can use it on the horizontal forehead lines. They can be used to treat the crow's feet, which is the fine lines that are caused by smiling. You can use it to treat the number 11 lines that sometimes form in the middle of the eyebrows, also known as the glabella. You can use it to treat the cute little bunny lines around the nose, to treat the vertical, oftentimes called smoker's lines around the mouth. It can also be used to treat gummy smiles, so people who don't want to see so much of their gums when they smile. It can be used to treat dimpling in the chin. It can be used to help decrease the size of the masseter muscles, which are the muscles that we use to chew. And sometimes people who grind a lot have a bit of hypertrophy or increase in size in that area. It can also be used to treat the horizontal necklace lines. And sometimes it can be used to help lift jowling by treating the platysmal muscles that travel from the base of the jaw down into the neck. I also use it for hyperhidrosis, which is when you have excess sweating. That can be in your underarms, on your hands, on the soles of your feet, and sometimes elsewhere on the body as well. And in some populations, botulinum toxin is also used to treat large calf muscles. It can also be used to treat migraines, headaches, menopausal sweats. So there's a lot of applications for botulinum toxin. So how often do you use these treatments? I would say, as I stated, it lasts between 3 and 5 months, depending on the area and the dosage that's used. So in some people who want to have a more natural appearing movement of the facial muscles may use less than somebody who wants to be frozen, and that's very dependent on the person who's having the treatment. But I don't think you need to start using them before you actually have the symptom. It's been around a very long time. It has a very high safety profile, a very low risk profile. It is an injection, and although it's a very small needle, there's always the risk of a little bit of bruising. More serious risks can happen if botulinum toxin is used too close to muscles that are needed for lifting the eyelid. So there is something called ptosis, which is when the upper eyelid drops, and that can happen with botulinum toxin that is injected too close to the levator muscle, which is involved in elevating the eyelid. And sometimes you can have a brow ptosis, and brow ptosis is what most people notice if they do have a complication. And that is in somebody who is a little bit older, who is having Botox or botulinum toxin on the forehead to treat the horizontal lines, and a little bit too much is used too close to the upper brow. When that happens, that can cause that brow to drop, which then can make the appearance that your eye is heavy, but in fact it's actually your brow that's a little bit lower. Sometimes if you don't have enough botulinum toxin on the forehead, for instance, you can get that spiky arched look that is quite dreaded these days. So sometimes people think that's too much Botox, but in actuality that's not enough botulinum toxin injected. There are some things that botulinum toxin does not help, and people often get fillers and Botox mixed up with one another. As I said, botulinum toxin is used to temporarily paralyze the muscles that cause fine lines and wrinkles, whereas fillers are used to do exactly what they say. They're used to help fill and volumize areas that may have lost volume. If this is your first time having botulinum toxin injections, I would say, again, research is super important. Make sure that you have the best expert doing your treatment, and for the injector to understand what it is you hope to achieve. It's really important to know what you can treat, what expectations to have, and how long they will last.